Hello, welcome to the Hey Boomer Show. She was in her late 40s, early 50s when she became the primary caregiver for both of her parents. She lived in North Carolina. They were in Florida, which meant a lot of traveling back and forth and working to get them the care they wanted and they needed. But she witnessed her parents not receiving the care that they wanted or needed because they were perceived as old. And if you're old, well, how much attention do you really need? Not always true, but it does happen. This was particularly the case with her mother, who passed away in 1995 from breast cancer that had metastasized. Eventually, she got her father to relocate from Florida to North Carolina to be closer to her, and she was better able to oversee the care that he received. He passed in 2003. Jeanette Leardi was changed by the experience of a decade of caregiving for both of her parents. She was inspired to pursue an encore career, different from the work she had been doing, because of her perception of how the aging process has impacted us as older adults. And she wants to help people appreciate elders' inherent dignity, wisdom, and unique value as mentors and catalysts for social change. And as a result of this experience and going back to school, she became a social gerontologist. So you will meet Jeanette Leardi in just a moment. Welcome to the Hey Boomer Show. My name is Wendy Green, and I am the host of Hey Boomer. Today, we're going to talk about what happens in a healthcare environment that might make you feel helpless or confused and frightened, and how to advocate for yourself or your loved one when faced with this situation. I'm on a mission to support and inspire older adults in this next act of our lives to find new beginnings, confront endings and transitions, and evolve into who they want to be. That mission is the fuel that keeps me motivated. And I hope that you find inspiration and motivation with the stories that we share on Hey Boomer. I am, as you probably know, hosting a trip to Costa Rica in the fall. In the summer, in June of 2023. And on Tuesday, tomorrow, at 5:30, I will be doing a joint webinar with Rhodes Scholar to talk to the designer of this program and the guide of the program, so we can learn even more about what we are going to experience when we go to Costa Rica. If you're interested in checking out and registering for the webinar, you can just go to the website at heyboomer.biz. There's a button there that says Costa Rica webinar, and you can click on that to sign up. So I hope you'll join us. I hope you'll join us in Costa Rica. It's a small group, 18 people. So hope to see you all there. Let's bring Jeanette on. Hello, Jeanette.
Hi there, Wendy. Thanks for inviting me.
So glad to have you, and welcome to the Hey Boomer Show.
As a boomer, I feel very welcome.
And you are. Jeanette Leardi is a social gerontologist, as I mentioned, a community educator, writer, editor, public speaker, and aging wellness leader who has a passion for older and adult empowerment and finds special personal fulfillment helping boomers and older generations identify and share their wisdom with others. She accomplishes this through her publications and successful presentations and classes in journaling, spiritual writing, memoir writing, brain fitness, health literacy, ageism, intergenerational communication, creativity, and caregiving support to people of all ages. Wow, we cannot cover all of that in 45 minutes. So let's focus on what we're going to talk about. But as I mentioned in the intro, Jeanette, you did a total career change, went back to school after your father passed. What was that like, making that total change and going back to school?
I had some trepidations about it because although I was last in a university setting when I got my master's in English, but then there I was in my 50s thinking, well, can I do the same thing? Remembering back in my college days and university days, writing papers and taking tests, and could I remember all the material, and would I be able to learn new things and retain what I'm learning, and how would I get
Sure.
along with the other students? So I had some trepidations, and it turned out that I wasn't the only older person in that class. There were about 3 or 4 of us in the graduate program, but and the rest were in their late 20s.
Mhm.
And it was a wonderful experience because of the fact that we just really shared so much and learned so much from each other. The younger people in the class seemed to have a lot of misconceptions about older people, just like older people can have misconceptions about younger people. And so we were able to straighten each other out as to the fact that we have a lot more in common than we think we do. So it was a great experience.
We do. And you managed to take your tests and write your papers and
Yeah, but you know
graduate.
what? Actually, because it was taught by gerontologists, we gerontologists understand how the older brain changes as we
Mm.
age, and so they constructed the classes in such a way that there wasn't as much memorization involved, that there was more uh, creative problem solving involved, and all of
Oh,
that. So my needs were being met, and the younger students' needs were being met too. So that was a very well constructed program.
perfect. Perfect. Well, I want to get into this whole advocating for ourselves as we get older in the medical arena. Um, and so my first question is finding a doctor. You move into a new community. A lot of us are new where I live, and you just find a doctor on your insurance plan, and you go, and you're like, he didn't talk very long. He didn't ask me questions. She didn't, she seemed to be looking at her watch, ready to go. How do you doctor shop?
Really good question. Really good question. Um, Keep in mind that COVID has changed a lot, changed the entire medical system a lot. But some of the basics are still very valuable and very important. What the first thing I would say to an older adult, by the way, I'm 70 years old. So I always say what my age is, no matter
Mhm.
whenever I'm given the opportunity, because I think we need to start to correct people's minds about what does a 70-year-old look like? Well, this is what this 70-year-old looks like. We can't make judgments as in general as to what an old person looks like. So anyway, I'm 70. Um, what the biggest change or the biggest attitude shift that we need to make, a lot of us as older adults, and this I found this with my parents too, was that a lot of older people tend to see the doctor as a higher up authority, and they don't want to make waves, they don't want to ask questions, don't rock the boat, whatever the doctor says is fine. I had to convince my parents to understand that we are consumers of healthcare. Patients are consumers. We're not victims that are looking for rescue. We should see ourselves as consumers. We spend more time shopping for a car and a house than we do for a doctor. When you think about it, I mean, our bodies aren't they the most important things in our lives?
Yeah.
So to have that mindset that we deserve the care that we want and that we need. So, in order to shop for a doctor, a lot of times people will go to ask friends, who's your doctor? A lot of, if you have a friend who raves about his or her doctor, well, you might want to check that person out. Um, if you already have a doctor of a specialty or even a GP that you trust, but you're looking for somebody else that's more of a specialist or vice versa, ask that doctor. Who, me best. Who would you suggest I look up? And then, you can with any doctor that you look for, you can always look up their background. There are state medical boards and county medical boards. And if you go to their websites and you type in the doctor's name, you should be able to get information as to where that doctor went to school, what years they went to school, if they were on any fellowships, are they board certified? It's very important to get doctors that are board certified. And if there are any judgments or actions against them. So that's a good place to find out that information. I'll tell you an interesting.
I'm just curious, when you said board certified, I would have thought they're all board certified or they can't be practicing. Is that not true?
Not really. They could be in the process of studying for their board certification. So they could be residents and they could be, it depends.
Yeah.
But it's always good and also to see how long ago they were board certified, because certain practices require people to keep up in their fields. So you might want to know, if that person's keeping up in his or her field. I'll tell you a story about how I found my father really good cardiac care when I moved him to where I was living in North Carolina. I won't recommend this technique, but people have complimented me on my originality. I knew he needed a cardiologist. I knew general practitioners that I thought I could recommend to him that he might feel comfortable with. But as far as a cardiologist, I didn't know. So I went to the hospital system, the hospital that I knew I wanted, where I would want him to have the best care. And I went to the nurses' stations of the ICU, the step-down unit, the cardiac floors. And I just asked them, I said, look, I'm moving my father to here. What cardiologist would you want taking care of you and your family? And they gave me a couple of names, and the same names kept popping up. And this one name was always the first one most of them said. Oh, this doctor, he's great. I would definitely. So I decided, let me start with this guy. And I called him up even before I moved my father moved to North Carolina. I called him up and I set up an appointment, and he met with me before my father even was in town. And he spoke with me and answered my questions. And then once my father came to town, I set up another appointment where he could meet him and give his, my father's approval of this is the guy.
Right.
And he was wonderful. He was amazing. And the point about shopping for a good doctor is you want to look for certain things. You want them to be compassionate. You want them to be competent. You want them to be good communicators and candid with you. So if they're the right fit for you, that's what you need. Remember, if you're going to shop for the car that suits you or the house that suits you, you need to shop for the doctor that suits you.
I love that story. That was a brilliant idea.
Yeah, I'm not sure many hospitals would agree to doing that these days.
Well, maybe not, but
this was back in the early 2000s. So
yeah, well, maybe they're letting us back in some places, but it's an interesting idea. And, a lot of times we feel like it takes so much time. You set up an appointment, you go meet one doctor, you don't like them. So now you got to go meet another doctor, so it does take time. But as you said, your body, you're going to have this body for 60, 70, 80 and more.
Right.
You're never going to have a car that long. So, right. So why not take as much time shopping for your own health care?
Right.
I like that. That's a really good point. So now we found the doctor. And so you want to prepare for the visit. And, a lot of places also now, Jeanette, they're not letting you bring somebody in with you because of COVID. And I know you talk about having a care team, so we might want to discuss that. But even if you can't bring somebody in with you, how do you prepare to go in for your visit with the doctor?
Okay. First of all, we doctors and nurses and all healthcare practitioners, they really want to help us. So we need to do the most we can to help them. Now, they have a real limited amount of time to spend with us. I don't know if people are aware of this, but the average amount of time that a doctor usually spends with a patient is about 15 minutes. It could be longer, but a lot of times it's only about 15 minutes. And an interesting study was done in 2018 about how long it takes a doctor to interrupt a patient when a patient is first talking about, well, here's why I want to see you today. It can range from anywhere from 3 seconds to about 230 seconds, and the average is 11 seconds.
What?
You have very, very, now I'm not sure I buy that, because my doctors listen to me. and maybe they're just used to me, but I think they're all, my doctors treat other patients the same way too. But the most important point is come with a couple of questions prepared, 2 or 3 questions. What are your biggest concerns? Why are you there today? If you can't bring anyone with you, I would suggest, and you have a hard time remembering what the doctors say, because they're going to load us up with a lot of information very quickly. You can even ask if you could tape record them. I've brought a tape recorder to doctors' offices to say, can I tape our discussion because I want to remember what you say? Most doctors that I found have no problem with that at all, because it's like taking notes, but instead of writing down, you're listening to a tape recorder. So have 2 or 3 questions. Even if you think, if something is bothering you that's unusual, but you don't think is related to your main issue, you might want to raise that question anyway, because doctors are detectives and they may know that the thing that you think is unrelated might actually be related. So raise that question as well. If you can't bring a friend with you or a child, I'm not I mean, I think in the practices that I go to, as long as you're wearing a mask, they would let a family member in. Everybody's masked.
Yeah.
But bring an updated medical history. This is what I do. I keep my medical history on file on my computer. And every time something with my medications, my vaccinations, my family history, all that stuff, it's only 2 pages long. And then every time something is different, I type it in red. I print it out. And the good thing about bringing up updated medical history is that you don't have to fill out the clipboard every time you see the doctor. How many times have you gone to a doctor where you have the same clipboard and you're answering the same 40 questions? I just say see attached, and I put the thing right on the board.
Oh, that's a good idea.
They see what's new and what needs to be changed. So
but you do talk about a care team. So tell me what that means.
Okay, a care team is more than just you and maybe the person, your care partner, which you really should have a care partner, especially if you think you're going to be in the hospital. It's really important to have somebody with you. If you don't have somebody with you, know that there are patient representatives in the hospital who can help people as well. They can serve as your liaison. But your care team is more than just you and your doctor. It's you, your doctor, maybe the other doctors. A lot of us older adults have many chronic conditions, 2 or 3 different conditions. So we have different specialists. So they should be part of the team. The nurses should be part of the team. If there's a social worker involved, that person should be part of the team. So the important thing is that they all work together. And then the other important thing is that you're hearing the information from a centrally located person. I had experience with my mother where she was under a neurosurgeon's care and also a gastroenterologist's care and other specialties. And I kept hearing different stories, different plans of what they wanted to do. So I finally said to my mother's primary care physician, I said, can you be the mission control and let everybody report to you, and then you tell us what they plan to do, and we'll all work it out together. So that's what a care team should be. They're all working together, and you should be the focus of your care. So there's something called person-centered care that I was searching for my parents for a long time to get them. Not institutional care, which is care that's convenient to the institution. Oh, we only serve breakfast from this hour to this hour. Or this is you have to take your shower at this time. But to do things that are more comfortable for the individual patient. So person-centered care is really important, and you should be the focus of all your care. So that's what I would recommend.
Yeah, we have a question here from Josephine. She says that when she goes to her doctor, she feels like she has good communication with her doctor and they compile all of her information on the computer. But apparently where she lives, once she goes into the hospital, the connection between the doctor's records and the hospital records are not attached.
Ooh.
And so she wonders how she can get consistent care and not have mistakes made so that, it works better. Oh, that sounds bad, Josephine.
Yeah, that's a serious problem. I don't know how affiliated the practice that she goes to is with the hospital. The practices that I go to, they have the same medical records as the hospital system. So when a doctor enters something, the hospital has that information. So it's a matter of how the administration and the practice are working together. I would raise that question with the administrator of the practice or the administrator of the hospital. How can those be coordinated? Because that's where medical mistakes can happen. if
Definitely.
those things aren't shared? Yeah, good question.
Definitely. Yeah. So, my mother recently was in the hospital. She broke her kneecap.
Mm,
Ouch.
mm.
And, her husband was also there, and I was there. And so sometimes it's a fine line to walk, to advocate and not be, and still maintain their dignity,
Right,
right? And
right.
respect that they are both intelligent human beings who can also, she was in a lot of pain, so she couldn't do much advocating. But what kind of suggestions do you have to handle that kind of a situation?
Well, um, first of all, everybody should have a healthcare power of attorney. Assign someone who will be making the decisions in the event that you can't make the decisions for yourself. So that healthcare power of attorney should be calling the shots when you're not able to, should be communicating with the doctors and all of that. But it's also very clear that you communicate to your healthcare power of attorney, this is what I want done, this is what I don't want done. A lot of times older adults don't want to have these conversations with their kids, whoever they are hoping would take care of them, help them, because it's an uncomfortable conversation. But these conversations, the earlier you can have them, the better off you are, because then you have the greater presence of mind and greater physical ability to say, this is the stuff I want happening. Do not ever have this done to me under any circumstances. The people don't want to have these conversations because they don't want to worry their kids. Actually, you're really relieving your children of a great deal of guilt and responsibility if they know very clearly what you want. I was my parents' healthcare power of attorney. And so I saw my position as not advocating for what I wanted, but for what they wanted. Even if sometimes I would have taken a different path, I knew this is what they wanted. And that was my job. My job was to be a substitute, a surrogate for them. So
Mm-hmm.
in your situation, Wendy, I would say the healthcare power of attorney needs to know what everybody's priorities are, especially your mother's, and to be working with the doctors on that
Yeah,
along the
which was the healthcare power of attorney wasn't there. That was my sister.
way.
Yeah. And so it was, the doctors would come in and be very gruff. The particular hospitalist there, he was very gruff.
Mm,
And, and my stepfather would try and get some care and they would ignore him. I think because he was older, my mother was older,
right, right.
we'll get to you when we get to you,
Oh, good.
until I got there.
Mm,
And then I stepped in and I wanted to also be sure though that I wasn't like taking over,
right.
because they still are competent human beings. It's just that they were being ignored and that really annoyed me.
Yeah, right.
So,
Exactly. That's a tough situation. I would also say that the way we communicate with doctors, they are rushed, but they also a lot of times they feel that they're the experts. The realistic thing is we are the experts of our own body. Not even a doctor knows our body better than we know our body in certain ways. So that to establish a relationship with the doctor where it's not this power structure, but that you're peers, you're a team. The doctor can supply you with information. You can supply the doctor with information. Again, going back to my father's situation, the doctors we found for him, that he and I picked out for him, they were actually our advocates in the hospital with the nursing team, because every time my father had
oh
to be
wow.
transferred to a different unit, I had to get used to a whole new team and they had to get used to me and him. But the doctors would be the ones that would say, we know who she is, we know who he is. She's not going to ask you for a lot, but when she asks you for something, really pay attention to it because she knows her father best. So they were the ones that actually
Wow.
smoothed the path for me with all these
Yeah.
nursing teams. And again, nurses are overwhelmed, and boy, oh boy, has COVID done a number on the hospital systems. People are
Oh,
leaving the profession. It's just really hard.
so hard. You're right. Now there is the idea. Um, I know you're from New York, but here in the South, you don't want to offend anybody.
Mhm.
And so when the nurse comes in and she says, "Well, have we had our shower yet today?" Or they say, "Hi, sweetie, how's your breakfast?" You understand they're trying to be nice, but it can also be very condescending and
Yeah,
infantilizing. And
yeah. Yeah.
How do you handle that in a way that says, I appreciate you're trying to be nice, but please don't talk to me like that. I don't know how your shower was.
Well, you just anticipated what my answer would be as a New Yorker. I would say, well, I've had my shower. Have you had yours? You know, um, um, and they are trying to be nice. They consider it a compliment by being affectionate or treating you as a younger person, sometimes speaking very loudly to us as if we're all deaf. you know
Right.
um, Unless somebody says, could you speak louder, I can't hear you, there's no need to shout at an older person or to speak very slowly unless people request that of you. So that's called elder speak. All of that stuff is called elder speak. There are ways of getting around it. You can use some humor, like, I've taken my shower, have you taken yours, kind of thing. um, but you can actually, you can actually say what you said, Wendy. It's like, gee, I know you're being nice, and thank you for being so courteous. To tell you the truth, you know, um, I can understand everything you're saying, and let's talk as if we're pretty much the same age, and I'll understand what you say, something like that. But recognize that they were trying to help. Here's the thing where ageism comes in. Why do they call us sweetie and cutie and all of that and say young lady? Because
Young
in our
lady, right.
society, being young is considered good, being old is considered bad. So
Mm.
they're trying to ease the sorrow and sadness and frustration that we must have because we're old people. We must feel bad about being old, which is absolutely wrong in many cases,
Many
or not
cases.
necessarily the case. And if we feel bad about being old, we need to adjust our attitudes about
That's
being
right.
old.
That's on us.
Right, that's on us. But they're trying to be nice. So, there are ways of finding that middle ground. And then if to call it somebody else's attention, you might speak to the nursing supervisor just to say, I know your nurses really do want to help us, but have they thought about the fact that some of us might not like to be called sweetie or honey? And to give them an alternative, if the nurse calls you sweetie, young lady, I'd say, you can call me Jeanette. I'm okay with
That's
that.
that's right.
See
That's
if that
right.
works.
Good suggestions. I know. And it can be uncomfortable,
Yeah.
but I wonder if, you did mention ageism, and so certainly that does come in. I've seen it and you've seen it. But I wonder if young people with that whole idea of doctors are so much smarter, if they also have difficulty advocating for themselves or even advocating for their parents.
I would imagine that they do. They get the reverse kind of ageism where the doctors or the nurses or people older think you're too young to know. You're too young to understand.
Mhm.
That's the reverse. Ageism goes both ways. We can be ageist toward young people too, to say, "Oh, you're not a grown up yet. You don't really understand. Haven't had the response. You haven't had enough experience yet." One way that younger people can advocate is to come informed, and young people and most old people too, older people, we're great at using the internet. Well, come with articles. I read in the Journal of the American Medical Association that X, Y, and Z. That might take the doctor aback a little bit, but the doctor might say, oh, this is a person who, does some research, and I can speak with this person in a different way than I could with people who don't do that. So
Yeah.
come informed and prove you have to kind of prove yourself, I guess, that you do have the understanding and the maturity and the ability. There are a lot of younger people who are actually caregivers to their parents or their
Their
grandparents. A lot of young
grandparents.
people under the age of 18.
Yeah.
So they can actually, educate the doctor, say, I've been taking care of my father who has congestive heart failure for 5 years. I know I'm 17, but I've been taking care of him. So kind of show your credentials. It's almost as if you're applying for a job and here's your resume. Here's your, here are your qualifications. I've been doing this for 5 years. You can talk to
Yeah.
me. I understand what the meds are. So that's a way of doing it, I guess, too.
That's a good idea. Now, you've written several blogs about being a smart patient, and tips for being a smart patient. I'm going to share your website so people can look for it there. But can you go through some of the tips that you have for being a smarter patient?
Sure, sure. The way I've organized them is I have 6 main tips, and I call them my health tips because each tip begins with the first letter of the word of the letters of the word health. So it's HEALTH. So H is hire your team, which is what we talked about. You're hiring. You're the boss of the group. You're going to do the hiring. Enlist a care partner. So we talked about a care partner. Now, a care partner is someone who really, you need to find someone who's going to really work and help you out and not be overwhelmed or too anxious or too abrasive or whatever. So you need to find somebody who's going to be your ambassador, really. Ask effective questions. So when you're in the office or you're in the hospital and you're given a new medication, there's some questions you should ask if you're going to be given a new medication, like A, what's this medication for? B, what are its side effects? C, is there a way of doing something more natural that I don't have to take a medicine? A lot of times, doctors will prescribe a medicine because they found that that's very effective. But a lot of times there may be some foods you can eat or some ways of adjusting your lifestyle. Could exercise lower my cholesterol first before you put me on a statin? Could we try doing this first? So that's something you can ask the doctor. What are the side effects, and what is the cost? I mean, cost is very important, especially if, although this may change now that Medicare may be able to negotiate drug prices, but cost could be, another question. Same thing with a treatment or a protocol. If the doctor says, you need surgery, or something, or some kind of treatment, I want you to go for a CT scan. Again, ask the same questions. What is this for? What is it going to show us? What will we do with the results? What does it matter what results we get? What's the worst that can happen if I undergo this procedure? What could happen if I refuse or if I wait? Can I delay the procedure? So just come with questions. And that's a way of handling those kinds of things. And ask if you're open to alternative methods. And then the other thing is, if you find that you're not getting the satisfaction about your condition that your doctor is giving you, think about getting a second opinion. Second opinions are, really kind of important to get, especially with big situations. If you're going to undergo surgery, I would recommend, no matter how wonderful your doctor is, I personally would always want a second opinion, just to, make sure. When something just doesn't feel right, or you're going to get something big. If to increase the objectivity, seek an opinion from a physician who's in a different practice altogether, because a lot of times physicians in the same practice have the same orientation toward certain things. So you might want to find a physician outside of that practice and
Good
get a
idea.
second opinion. Find out if your insurance will cover a second opinion. That's also very important. And then if your physician objects to you finding a second opinion, ask why. Because I haven't found, and I've gotten second opinions on things in my life, I've never found any of my doctors objecting to it. They would say, sure, get a second opinion, fine. They want to know, they would want someone else to confirm what they've said. Here's the interesting thing. A 2017 study by the Mayo Clinic found that when people got second opinions, 12% of those diagnoses were confirmed. 88% of them were either new diagnoses or somewhat changed or modified diagnoses.
Really?
Yeah. So
Wow.
it might be to your benefit, especially when it's something very serious. You might just really want to get a second opinion.
Wow.
Yeah.
And even when you try to be a smart patient, sometimes you forget. I was seeing my doctor a couple of weeks ago, and I was in a lot of pain in my neck, and I'd been in pain for probably a year.
Ooh.
Of course, we've tried everything, right? So he said, well, let's do an MRI. And I said, okay, let's do an MRI. And then it wasn't until I left the office that I thought, well, what are we looking for? And what if we find something, then what do we do? So fortunately we have a online my chart, so I could,
That's what I was
ask.
going to say. It's
Yeah,
very important.
but
Get on the portal. If your hospital or practice has a portal, get on your portal, because then you could always email your physician or a nurse or with the assistant or whatever, and get those questions answered. Yeah.
I know, because you may not remember in the moment. There's just, you just want relief in that moment.
Right.
So,
Exactly.
yeah.
That's a very good example to bring up. Very important.
Yeah. So thank God they have those things now. Yeah. So we have covered a lot. I'm just wondering if there's like 2 or 3 takeaways, like if you just had to give us 2 or 3 things that we should remember going forward, what would you say?
Actually, what I would do is add the last three of my health
Oh,
tips.
okay.
The LTH.
I thought we didn't get to LTH.
So the L is learn about your body. There are certain numbers that you need to keep track of, your cholesterol, your blood pressure. If you have, talk to your doctor about whether it's advisable for you to be taking your blood pressure at home. You can get a blood pressure machine and, record it. This way, when you go back to your doctor, you can show the doctor the list of all your blood pressure readings, and that can help your doctor figure out if you're on a trend of getting better or may need to be put on a different medication, that kind of thing. So learn about your body mass index, your A1C, your blood glucose. Are you pre-diabetic? Do you have a tendency toward diabetes? That's very important for the doctor to know about too. Take charge and control. You're calling the shots. You're the one that should be the focus of all the care. So here's the thing. When you and your doctor agree to a certain protocol or a certain medication, consider the fact that you've made this oral contract with your doctor. Your doctor has agreed to do X, Y, and Z for you. Now you have responsibilities too. You need to be compliant. So if the doctor puts you on a med and says take it 3 times a day or every 6 hours, do it accordingly. Fulfill the contract. If you find you have some side effects, let the doctor know right away you're having some side effects. A lot of times it's an alternate medicine you can be put on. But fulfill your responsibility. You have responsibilities too. So take charge and control. And the way to be in control is to be as responsive to the doctor as possible. Again, doctors aren't mind readers. The more information you give them, the better they can take care of you. And then finally, have vital plans in place. Do you have a living will? Do you have a healthcare power of attorney? There are some things called, there's something called a POLST form, Physician Orders for Life-Sustaining Treatment. Every state has its own POLST form. That's filled out by a doctor when you have a very serious medical condition as to what to do in case of an emergency for you, which is different from a living will, by the way. And then discuss your wishes with your doctor. I have my living will, and my living will is kind of extensive because I attached a list of things to it. But my doctor's office has it, the hospital has it, my healthcare power of attorney has it. So discuss your wishes. And, so plan ahead. You may feel great now, but there may come a time when you're not feeling so great. So plan ahead.
I like that. That's so take responsibility for yourself and your care.
Right.
Have your vital plans in place and learn about your body. Yeah. It's so easy to just look it up. That if you ask me what my cholesterol and my HDL and LDL were right now, I'd be like, oh.
Well, and we're not expected to know those numbers. You can only find those out when you have a lab test. But if you haven't had a cholesterol test done in 3 years, you might want to say to your doctor, I haven't had my cholesterol checked in 3 years. Can we check it? Can we have it? I would bet a doctor who knows that you haven't had a test in 3 years will order that test.
I would bet.
Yeah, good to know.
I would bet. Yeah, so. I would bet. Thank you so much, Jeanette.
Thank you.
This has been wonderful. As I shared her website, if you have questions for Jeanette, she is an extensive writer and has so many resources out there on her website. It's Jeanette, JeAnette, Leardi, LEARDI.com. And I mean, it is a wonderful resource. I would encourage everybody to go check it out and connect with Jeanette wherever you connect with people on the internet. Super intelligent and caring woman. Thank you so much.
Oh, Wendy, this was such a pleasure. You asked such great questions. I think I hope it was very informative to people.
And, I'm sure it was.
Keep our spirits up. It's great to be old. It really is.
That's right. Great to be old, especially when we can try and take care of ourselves, advocate for ourselves.
Right.
Yeah. So, just a couple of reminders to encourage your friends to check out Hey Boomer. They can go to heyboomer.biz, which is my website. They can connect there. There's a connect with us button there where you can get onto the email list and find out all about what we're doing here and all the wonderful speakers that are coming up. You can also register for the Costa Rica webinar, which is tomorrow. I would love to have as many of you on this trip as we possibly can. It's going to be so amazing. You can also always drop me an email at wendy@heyboomer.biz. And please check out our sponsor, Road Scholar, which I'm trying to find their link right now. Oh, here it is. It's road, ROAD scholar.org/heyboomer. We are so grateful to them for their support of the work that we're doing here. So let me tell you about next week. Next week, it's going to be me. You're just going to have me next week. And I'm going to be talking about social change from the perspective of the changes that we went through as boomers changing society, and how millennials and Gen Z are looking at changing society because of climate change and because of the longevity that they're looking forward to. So, it's a thought-provoking discussion I want to have with how do we start to bridge the differences and bridge the gaps, instead of saying, the millennials blaming the boomers and the boomers blaming the millennials. Let's stop the blame game and find ways to communicate and work together and be stronger together. So that's going to be what I'm talking about next week. I hope you can join us for that. And I always like to leave you with the belief that you can live with courage, live with relevance, and live with passion. And remember that you are never too old to set another goal or dream a new dream. My name is Wendy Green with Jeanette Leardi. Thank you again.
Thank you.
And this has been